We've got a couple of people that want to talk about cold, flu, and COVID. So the first is Kathy saying COVID is now the new cold. And then Steven says, are we using the discontinued PCR test, which can tell the difference between the common cold, the flu, or COVID?
Yeah, so these are excellent questions. In an unvaccinated population, as we saw, thousands of people dying per day. If you have a fully vaccinated population, you may be seeing numbers more consistent with what we saw with influenza, maybe 100 or so deaths per day. Most of those, with influenza, 90% were in people unvaccinated. The hope is with a fully vaccinated population, or as close as we can get to that, for a vaccinated individual, the risk of death, the risk of hospitalization will be sort of that what we're used to seeing with flu. But if you're unvaccinated, we're still seeing a 2% case fatality rate. We're still seeing really bad outcomes. So turning COVID into more like a common cold flu is gonna involve getting everyone vaccinated. The second is the testing. Now we've really, I think, got ramped up as far as making these tests available, making them accurate. We can now clearly distinguish between COVID, between RSV, between influenza A and B.